Hi, my name is Doris Onoha, a DMP student at Bradman University. Today I will be talking about stakeholders' educational plan based on obesity education management among overweight and obese Hispanic adolescents 10 to 19 years of age. Childhood obesity is a serious global health challenge. In the United States, the obesity epidemic has been an ongoing issue that affects both sexes, racial, ethnic, and socio-economic group. Adolescent obesity is on the rise around the world. Obese children are more likely to grow into an obese adult and at risk of developing serious health complications such as diabetes, cardiovascular diseases, and behavioral issues. The issue of being an overweight child in the Hispanic population is significant because being overweight and obese is problematic in this culture. Childhood obesity is a serious health issue, even though genetic predisposition could play a role, but majority of the problem is attributed to poor diet, lifestyle choices, and lack of exercise. Statistics have shown that 22.4% of Latino children ages 2 to 9 are obese, compared with 14.3% of white children. More than 38.9% of Latino children are overweight or obese, compared with 28.5% of white children. In the United States alone, an estimated obesity-related illness annual healthcare cost is $190.2 billion of annual spending, of which childhood obesity is accountable for $14 billion of direct medical costs. That includes emergency room, outpatient costs, and prescription drugs, in addition to $237.6 million inpatient costs. Therefore, the simple and cost-effective way to correct this pressing issue and preventing serious health complications is by correcting bad nutritional habits and lack of exercise. How do I plan to implement this evidence-based research into practice? This will be implemented in an outpatient pediatric setting. I plan to bring stakeholders to help assist patients to control and reduce their body mass index level. And with interdisciplinary collaboration with an NP, Hispanic dietitian, fitness coach, medical assistants, patients, and families. I chose Hispanic dietitian due to some of the patients might be Spanish speaking only. Therefore, to avert language barrier and to be able to relate anything they need to know about their diet choices. The NP will assess and get their pre and post weight and BMI. Fitness coach will assess and recommend appropriate fitness exercise suited for their age. Medical assistants will assist with patient selection and assist in data recording. Families will assist in encouraging patient moral support and giving consent before carrying out the project. Each of the stakeholders will have a role in assisting patients to attain their goal and help reduce healthcare costs. To achieve this goal, I intend to implement Imogen King's theory of nursing. The theory comprises a conceptual framework of interacting systems at a personal, interpersonal, and a social system, and a theory of goal attainment. The theory elaborates on nurse and patient interaction at personal level, and interpersonal level is interaction with stakeholders, which are NP, dietitian, fitness coach, and medical assistant. This will enable stakeholders to interact effectively to achieve a common goal. I will also apply system thinking of hands. It will enable us to understand and adapt to our environment. The ABCD model will assist in feedback of patient outcome. Patient education is very essential in controlling and improving BMI to avoid health complications. Evaluating their knowledge of the disease process, diet profile, exercise logbook, diet logbook will be assessed during this project. Before the start of the project, the preliminary intervention will be conducted, which will include pre-weight and height, BMI, blood pressure, and vital signs, and as needed. And after 3 months of the project, the weight and BMI will be reassessed. Additionally, adding culturally specific dietary and lifestyle education alongside with patient other treatment plan will be implemented as well. Teaching patients about healthy choices and self-management of obesity will be implemented. Our study has shown that proper management of obesity with diet and exercise thus reduce health risk complication and boost self-esteem. Therefore, patient education is very vital in reduction of and control of BMI and promotes better quality of life. For better outcome, cost effectiveness analysis will be utilized in this project. And this will aid to improve BMI, healthy diet choices, and understanding of the disease process, and help prevent complications associated with obesity. Again, patient feedback and overall satisfaction to the value of this project will be measured in terms of patient outcome and financial impact. We can anticipate the values from this project by looking at the past and present research that has been conducted in the past. This comes to the end of my video.